Welcome to one of the most incredible journeys of your life. If you are expecting a baby or planning to start a family, understanding what lies ahead is the first step. The path to motherhood is filled with excitement, questions, and a whole lot of change. Think of pregnancy as a marathon, not a sprint, divided into 3 distinct stages called trimesters. Each one brings its own set of milestones, developments for your baby, and changes for you. Knowing what to expect can help you feel more prepared and in control as you navigate this amazing process. It's a time for learning, growing, and preparing to meet your new little one. The pregnancy timeline is typically about 40 weeks long, counted from the first day of your last menstrual period. This journey is neatly broken down into 3 trimesters. The first trimester spans from week 1 to the end of week 12. This is a period of rapid development for your baby, even if you don't have a big belly to show for it yet. The second trimester covers week 13 to the end of week 26. Many women find this to be the most comfortable phase of pregnancy. Finally, the third trimester runs from week 27 until you give birth, which is a period of major growth for your baby. As you move through these stages, it's important to understand what full term means. A pregnancy is considered full term when it reaches 37 weeks. However, the window for a full-term delivery extends all the way to 42 weeks. Babies born within this 5-week window are generally healthy and well-developed. Anything before 37 weeks is considered preterm, which might involve a stay in the neonatal intensive care unit. Going past 42 weeks is called post-term, and your doctor may discuss inducing labor to ensure the baby's safety. This timeline provides a helpful roadmap for you and your healthcare team. Each trimester brings its own unique experiences. During the first trimester, you might feel very tired and experience morning sickness as your body adjusts to soaring hormone levels. The second trimester often brings a welcome burst of energy, and you'll likely start to feel your baby's first little movements. This is often a time when you can really enjoy being pregnant. The third trimester is all about preparation for birth. Your baby grows quickly, and you may feel more uncomfortable as your belly gets bigger, leading to backaches, heartburn, and frequent trips to the bathroom. As you approach the end of your third trimester, you'll likely be on high alert for any signs that labor is starting. Your body provides several clues to let you know that the big day is getting closer. One of the most common signs is the lightening, which is when your baby drops lower into your pelvis. You might suddenly find it easier to breathe, but you'll also feel more pressure in your lower abdomen and may need to urinate more often. This can happen a few weeks or just a few hours before labor begins, especially for first-time mothers. It's a clear signal that your body is getting ready. Another sign to watch for is the loss of your mucus plug. This is a thick plug of mucus that has sealed your cervix during pregnancy to protect your baby from infection. As your cervix begins to soften and open up, this plug may be discharged. It can come out all at once or in smaller pieces, and it might be tinged with a bit of blood, which is often called the bloody show. While this is a good sign that things are progressing, labor could still be hours or even days away. It's simply another piece of the puzzle falling into place on your journey. Of course, the most definitive signs of labor are consistent contractions and your water breaking. True labor contractions become stronger, last longer, and get closer together over time. They don't go away if you change positions or walk around. Your water breaking, or the rupture of the amniotic sac, can feel like a big gush of fluid or a slow, steady trickle. If you think your water has broken, it's crucial to contact your doctor or midwife right away, as there is an increased risk of infection once the sac is no longer intact. These are the telltale signs that it is time to head to the hospital. Behind the scenes, a complex dance of hormones is responsible for kicking off this entire process. The main players are oxytocin and prostaglandins. Oxytocin, often called the love hormone, is produced by the brain and causes the uterus to contract. As labor progresses, your body releases more and more oxytocin, making the contractions more powerful. Prostaglandins are hormone-like substances that help to soften and ripen the cervix, preparing it to dilate. Together, these hormones work in a powerful feedback loop to move labor forward and bring your baby into the world. Labor is a dynamic process divided into 3 distinct stages, each with its own purpose and timeline. The first stage is typically the longest and is all about getting your cervix ready for delivery. This stage is itself divided into two phases, early labor and active labor. During early labor, your cervix gradually effaces or thins out and dilates or opens to about 6 centimeters. Contractions are usually mild and irregular, lasting 30 to 45 seconds with long breaks in between. For many women, especially first-time mums, this phase can last for several hours or even days, and it's often best to spend this time resting at home. The first stage transitions into active labor when your cervix dilates from 6 to 10 centimeters. This is when things really intensify. Contractions become much stronger, last longer, around 60 seconds, and come more frequently, perhaps every 3 to 5 minutes. You will need to focus all your energy on managing each contraction. This is the phase when you would typically head to the hospital or birth center. Active labor can last on average from 4 to 8 hours, but every woman's experience is different. It's the hardest work you'll ever do, but it's productive work, bringing you closer to meeting your baby. The second stage of labor begins once your cervix is fully dilated to 10 centimeters and ends with the birth of your baby. This is the pushing stage. You'll feel an overwhelming urge to bear down with each contraction to help move your baby through the birth canal. This stage can last anywhere from a few minutes to a few hours. Your healthcare team will guide you on when and how to push effectively. It is an incredibly intense and empowering phase. Seeing your baby for the first time after all that hard work is a moment you will never, ever forget. Finally, the third stage of labor happens after your baby is born. You may think the work is done, but there is one final step: delivering the placenta. This is the organ that nourished your baby throughout the pregnancy. This stage is usually quite short, lasting anywhere from 5 to 30 minutes. You will continue to have mild contractions that help the placenta separate from the uterine wall. Your doctor or midwife may gently pull on the umbilical cord or massage your abdomen to help it along. Once the placenta is delivered, the process of labor is officially complete. When it comes to how your baby will be born, there are several different types of delivery. The most common is a normal vaginal delivery, where the baby is born through the birth canal without the use of instruments. The main advantage of this method is a shorter hospital stay and a quicker recovery time for the mother. It also helps squeeze fluid from the baby's lungs and exposes the baby to beneficial bacteria in the birth canal. The downside can include tearing of the perineum, the area between the vagina and anus, and in some cases, a weakening of the pelvic floor muscles. Sometimes, a little extra help is needed during a vaginal delivery. This is called an assisted vaginal delivery, and it involves the use of either forceps or a vacuum extractor. Forceps are a tongue-like instrument that is carefully placed around the baby's head to guide it out. A vacuum extractor uses a soft cup that attaches to the baby's head with suction. These methods are typically used if labor has stalled or if the baby is showing signs of distress. The major pro is avoiding a cesarean section, but cons can include a higher risk of tearing for the mother and potential for minor bruising on the baby's head. In some vaginal births, an episiotomy may be performed. This is a surgical cut made in the perineum to enlarge the vaginal opening and prevent ragged, uncontrolled tearing. Doctors might perform one if the baby's shoulders are stuck or if the baby needs to be delivered quickly. While once routine, episiotomies are less common today. The benefit is creating a wider opening for birth, but the downside is that the incision can be painful during recovery and may sometimes be larger than a natural tear would have been. Healing can take several weeks, and it requires careful attention to keep the area clean. A cesarean section, or C-section, is a surgical procedure where the baby is delivered through an incision in the mother's abdomen and uterus. A C-section can be planned in advance for reasons like the baby being in a breech position or the mother having certain medical conditions. It can also be performed as an emergency procedure if complications arise during labor. The primary benefit is that it can be a life-saving procedure for both mother and baby. The main drawbacks include a longer recovery period, risks associated with major surgery like infection or blood clots, and a higher likelihood of needing C-sections for future births. The decision about which delivery method is best is not always straightforward. Doctors consider many factors when recommending a specific path. For example, a cesarean section might be advised if the baby is in a breech, which means feet first, or a transverse, which is sideways position, as a vaginal birth would be too risky. Other reasons include having twins or other multiples, a very large baby, or if the mother has a health condition like high blood pressure or an active herpes infection that could be passed to the baby during a vaginal birth. The safety of both you and your baby is always the top priority. Sometimes, the plan has to change during labor. An emergency C-section might become necessary if labor isn't progressing, the baby's heart rate becomes concerning, or there's a problem with the placenta or umbilical cord. An assisted delivery with forceps or a vacuum might be chosen if you have been pushing for a long time and are exhausted, or if the baby needs to be born quickly. These decisions are made in the moment by your medical team to ensure the safest possible outcome. Being flexible and trusting your providers is key, as birth can be unpredictable. It is completely normal to have a birth plan and to hope for a specific type of delivery. However, the ultimate goal is a healthy mum and a healthy baby. Try to stay open-minded, because the most important thing is adapting to what your body and your baby need on the day. Whether you have a vaginal birth, an assisted delivery, or a C-section, you are bringing a new life into the world. Each path is a valid and powerful experience. There is no easy way out when it comes to childbirth. Every mother is a warrior, no matter how her baby arrives. Remember, you are not alone in this journey. Your doctor or midwife is your partner in this process. They will discuss all your options with you, answer your questions, and help you make the most informed decisions based on your unique health and circumstances. Every pregnancy, every labor, and every birth is different. Trust in the guidance of your healthcare team and trust in your own strength. Your story will be your own and it will be beautiful. Congratulations on this incredible adventure ahead.